Hello and welcome to an EM360 Human Rights Day special where we will be outlining the importance of mental health in and out of the workplace. My name is Ross Hurley, social media and SEO manager here at EM360, and today I'm talking to Dr. Jacqui Taylor, CEO and founder of Flying Binary. Dr. Taylor is also an expert advisor to the European Commission, a strategic advisor to the UK government, a G20 and a UN advisor, and I feel as if I said anything else about her, I'd be here all day. Dr. Taylor, it's an absolute pleasure to be speaking to you here at EM360. Would you be able to tell the audience anything else about yourself, please?
Absolute delight to be here on a subject that really for us is the foundation of Flying Binary. We're a deep tech company with the web science that we've pioneered since we were formed in 2009. But our mission is one of inclusion, and by that I mean leave no one behind. So human rights is at the core of everything that we do and the technology that we build.
Yeah, that's fantastic. When we talk about human rights then, just to kick off, it's important to outline what the definition entails. Now, in the UK Human Rights Bill of 1998, it outlines that all public authorities, including the government, police, NHS and local authorities, must treat everyone equally and with dignity, fairness and respect. It also includes that if you have a mental health problem, you must be treated with respect by staff and service providers. Now, in 2019, a poll from Mental Health First Aid England revealed that only 14% out of 2,000 correspondents felt comfortable talking about mental health at work. Jacqui, you have a plethora of experiences to talk about, and from all of your time working in the tech among several different projects. Is the stigma something that you've encountered a lot of?
Absolutely. I mean, I'll talk to you in some detail about what we're doing about it, because it's all very well to know the problem, but to actually to provide some solutions towards that is the key thing, because we need to move forward. And I think it depends. It doesn't depend actually on who you talk to, in whatever setting you talk to. It is still something that the population at large are not comfortable with. We have technology at Flying Binary where we connect directly to anybody that's online. So we can go and speak to the entire planet and ask them the wicked questions like, how do you feel about mental health and what have you. I can't actually give some of those results away, but we've contacted people in their millions across the globe, because it's not one territory. It's actually inclusion is about understanding it for all, irrespective of the regulation, legislation that operates in any territory. And because for myself as a UN expert advisor, it's actually about us on the planet. It's all of us. And obviously the mature agendas perhaps take that a bit further, but there are other areas across the world where there aren't the basics of what we're talking about. And it doesn't differ. It doesn't differ. It's something that is becoming more of a discussion, perhaps in closed forums or in networks, and networks are springing up to discuss this. But in an open environment, as a public conversation, even with those agencies or NGOs that specialize in this, it's still a conversation that has many more barriers for discussion. It's not an open conversation at all. And we work at all levels in all settings, and I can say as a blanket, it's something that is still, I don't know if it's just stigmatizing. It's actually something that's an uncomfortable conversation. And largely that's partly because not many of us know the setting very well. You get the clinicians who perhaps understand it in terms of its impact when mental health isn't discussed. But we don't generally, not just in workplaces, not just in our homes, we don't generally know quite how to discuss it and the context to give it. So that's what we found when we're doing our evidence-based work around mental health. Usually it helps to set a context in whatever setting we're working in, be it a clinical one, be it a commercial one, be it a government one.
Yeah, no, I think that's a really interesting point to bring up as well, that it's not just necessarily stigma. There's a whole variety of different problems that can occur. And it's worth pointing out that mental health as a whole, or understanding about mental health, is I guess, a relatively young thing for people to understand. Do you feel that managers, C-suite executives, directors, and other upper management types are also concerned about bringing up mental health problems at the workplace?
Well, yeah, and I think that's likely because we don't have a general awareness of it in the corporate environment, and there's very little in terms of education. And often what happens is you bring in a specialist to deal with a particular intervention, but there's no ongoing follow through on that. And so often what we do with our technology in Flying Binary is we will put some technology in to keep the ongoing progress. Because it's, I mean, I would always take any client through the journey and do whatever intervention they might want, which for me might be a keynote speech. It doesn't necessarily need to be deployment of technology, because it's such an important subject. And what I say to the CXOs, I mean, I did a session with the Fortune 100 CXOs during the pandemic. And what I said to them is, the health of your company depends on the health of your employees. And so that sort of message, and I'm doing an intervention with those CXOs called Leadership in Excellence. And this is one element of that. So as I'm positioning it in a business context as leadership training, because actually we need to get some education in there, but it's not we do it on this day on Human Rights Day. It actually should be a constant activity, but we can't expect people to know exactly what to do about it because of all the things that we just talked about why it's difficult to discuss and the barriers around it, which are not just stigma.
Yeah, exactly. It's something that can't just come about when the wind blows or in special days. So I guess that kind of brings me on to my next point, which you've touched on a little bit in the last question. But are there any platforms that you're working on that are helping to alleviate any mental health struggles at work or otherwise?
Yeah, so there's a couple of interventions that we've got going. One that was directly as a result of the pandemic. I delivered the G20 plan literally about 6 weeks before we all went into lockdown across the world. And so 1 billion people then went virtual practically overnight. And that changed the dynamics of everything. And it was very clear to me, having done the assessment for the G20 members, and then with the isolation economy, as I called it, that when we came out of this pandemic, which of course we're not out of yet, we would need different interventions. And so what I've developed as part of my work in the United Nations is something I call the empathy economy. And what that's about is, when Flying Binary was formed in 2009 as a result of some work with Sir Tim Berners-Lee to move the needle and connect people across the planet to the World Wide Web on the 20th anniversary of the web, was about delivering everything we do online via something we call the sharing economy. Now, when we talk about this in a human rights and in a mental health context, where are we with that? Well, the G20 assessment was very clear. That's 40% of the world's GDP, not in a good place. If you take that to the 180 nations in the UN, in a very bad place, because there are many areas in the world that don't have even the basic rights of any kind. And so one of the things that I looked at was, the technology is an enabler. That's a foundation for Flying Binary and the deep tech that we build. And I just need to sort of just contextualize this. I'm not talking about digital platforms. I'm not talking about, social media platforms. I'm talking about things like the industrial Internet of Things, artificial intelligence, all the things that are pervasive technology that effectively connect us. And we might be talking to a robot, or we might be actually talking to a human, but we would never know. And that's not with everybody yet, obviously across the globe, but the more mature nations using technology, that is where they are. And it became clear when I did the assessments on 40% of the world's GDP, and then looked at the gap between the G20 and the UN, that actually where we were with this sharing economy was not in a good place for this very specific reason. And that is because the technology that we've enabled as a result of the sharing economy is invested in the hands of the very few, mainly on the west coast of America, with some of the principles that, from a human rights point of view, we wouldn't agree with, and actually we didn't negotiate either. We found ourselves there because technology has been the outcome, not the enabler. So that intervention was, I moved into my UN work, I realized that we needed a new economy. And so I coined the term the empathy economy. And what's the difference? Well, in the sharing economy, we talk about competitive, and we talk about the fact that it's bottom line driven. It's about GDP, and that's what's got us to here. You know, that's why we're even having this discussion today. Whereas the empathy economy is based on values. It's based on collaboration. It's actually based on the fact that if you can use technology to enable communities, citizens. I have a huge network of young people across the world who have learning differences, who, you know, will interact in the world in a different way, not because they've had a mental health assessment necessarily, or they may have, but they've got other learning needs that technology allows them to contribute to society. So if you navigate, and I didn't want to sleepwalk our way further into the sharing economy with the work I'm doing with the UN. So it was actually resetting that and saying, well, what we should be doing is value driven. And when the Fortune 100 want you to talk about doing that in their companies, it's not something I've invented and think might be a good idea. But what I have done as a result of the recent COP26 event, where we haven't made all the progress we needed, is actually we're building at Flying Binary at the moment technology to onboard entrepreneurs. We're going to onboard a maximum of 1 million entrepreneurs. The network at the moment is 100 million in 170 countries, but 1 million of those will get the opportunity to come on board with us and drive that new economy based on value. And that will literally change the landscape of how we've applied human rights where technology is involved. So that's one thing. But then the other thing you mentioned, which is really important from a pandemic point of view, and this is, I'm the only technologist in the UK that's ever put technology across the whole of the National Health Service. And we have a fairly unique offering in the UK about how we look after public health. And I've been approached by a number of very senior clinicians who I've known for very many years, who actually were already evidencing about a deterioration in public health for our young people, those under 18. And actually, it used to be between 18 and 8, you know, concerns from a clinical point of view, and really concerns about what was possible to do to help those young people get better. As a result of the pandemic, that is 18 to 6 now. And we are seeing on average on the general practitioners, the doctors, they're seeing on average 40% of their patients that come through the door have got the early signs of mental health conditions. And we already have, you know, huge proportions in our National Health Service that we're struggling to deal with. So what we've done is we've built a platform that repurposes some of the AI we've built to understand at a global level, you know, what citizens need. If I'm going to challenge the G20 on what they're going to do, I better have some data that's better than theirs and some reason why they would do it. So actually utilizing that data with some other to actually use that AI service to put an intervention in that supports an individual taking charge of their own mental well-being. And so essentially we've got 2 pathologies, 2 clinical needs that we've been asked to look at, which are anorexia and bulimia. And because of the rise in anxiety and depression as a result of this pandemic, those are the precursors often to both anorexia and bulimia. So it actually allows us to look at supporting those young people on their journey to getting well, based on the content they're consuming online. We have absolute evidence now that the sharing economy has generated technology that's affecting our mental well-being in a very poor way. Some of the people may have seen the recent Wall Street Journal investigation on what's been happening on Instagram for anorexia and bulimia. And so, you know, it's a given that we know that this technology is badly affecting the mental well-being of these young people. And when I just want to say in the acute settings, when there's a real concern for the safety of these young people from clinicians, their options, these young people as young as 6, are self-harm and suicide. We're not talking about not feeling good about things today, through to being under the care of a doctor because they're struggling to cope with the impact of this pandemic. So we've created something which we've codenamed. That's part of our counter-terrorism background, I'm sure, but we won't call it this when we launch it. But we've called it the Social Guardian, because it actually gives us a choice about whether we consume that content based on the AI that's been trained across the world on 4 billion data points to know whether content is emotionally safe or risky to humans. And so essentially it gives, before you get that content served, it says that, the people across the world consider this content risky. Do you want to consume it? It doesn't stop anybody doing anything, but it's like an advisory AI. And it just is enough from a clinical point of view to interrupt those neuron pathways. So before you press the button, think, do I want to consume this? And then, of course, if you keep getting that risky warning on content that to you looks safe, because until you had the Social Guardian, you didn't know there was any problem. And then, of course, the clinician can say, well, that's one of the things we need to address. So it really advises the clinicians of another way of helping a patient understand how they're able to take charge of their mental well-being. And at the end of the day, we've had a number of discussions in the corporate world of, because of all the work from home and the change and delivering everything digitally, there's many human resources teams who are also struggling to know how best to serve, the employees. And so we're having separate discussions now as to whether we can repurpose that on a company-wide basis, such that, it can give some additional support to those people who are having to use online services because it's their job, some of which may be detrimental to their mental well-being. So that's where we are at the moment. And I just want to say one other thing on that. It's such the work we're doing is based on the UN's Convention on the Rights of the Child. That's underpinned the philosophy of this intervention, this Social Guardian intervention. It was compelling enough for the UK's Information Commissioner to go into partnership with Blind Binary to look at how we might create a perspective on this that actually uses regulation that's also in place, something called the Children's Code, the Age Appropriate Design Code, which came into UK law and European law on the 2nd of September 2021. So to try and bring all the tools we have together with empathy economy tech, with legislation, regulation, and conventions from the UN, and actually put that in the hands of the patient so they have their own say about their own mental well-being and able to advise clinicians of any additional information that will help support them to assessing it. And that for us is bringing together the best of what we do on a core foundation of inclusion, meaning leaving no one behind. And I think in this setting, Ross, it's more important than anything we've done before, because this pandemic has exacerbated this problem in a huge way.
Absolutely. I really like this idea of using clinicians to provide their expertise to this sort of thing, because they obviously have a further understanding than most of us do. And the thing is with a lot of social media giants is that they push things on our newsfeed that are pushed onto us without our consent and can cause severe harm. I'm only 25 years old, and this is a problem even for me working in social media. And obviously having the expertise of clinicians to help protect me and also younger people can only be a valuable thing. So it's something definitely corporations really need to think about.
Conversations we've been having with the CXOs are, you could then support them so that they're able to flag to you about which parts of their job potentially are detrimental to their mental health. And then that allows a negotiation and a conversation within a team about how best to format that work going forward. But it's the fact that we're unaware of it. But if it's your job to actually have, interaction with social media as part of what it is, how much of that is harmful to you? I don't know at the moment, and nor do you. And so this is about obviously taking that clinical assessment piece that we've been doing and the partnership we have from a regulatory point of view with the Information Commissioner, and actually making that available to corporates. And it's a genuine thing in the same way that the GPs, the doctors in the UK see this as a genuine way in which when the patient's not in their surgery, they know they can serve them. Then that's the way in which corporates are looking at this as well. They're saying, you know, on a 24-hour basis, not that anybody should be consuming this on a 24-hour basis, but some people do, on a 24-hour basis, irrespective of where their employees are, what they're actually doing, it's with them, the social guardian's with them. And corporates are very much embracing this idea that it's a positive step towards better health and well-being for their employees, which is not some sort of oversight or, you know, made to feel like, there's something wrong with you. It's just an extra tool in the tool bag, and an advisory, as I say, you can override it if that's what you choose to do. But it's very difficult in this particular domain, as we said earlier, because of the barriers around it, for a corporate level to know what you can genuinely do to help. And so this is a way of in the same way perhaps people get gym memberships, or they get annual health checks, then the social guardian is another part of the package, health and well-being package that organisations can put together for their staff.
Yeah, Dr. Taylor, I'd like to say that this seems like a really good step in the right direction. I think that comes from everyone watching here today. Thank you to all of our audience today. And if you're interested in learning more about enterprise tech, follow us on LinkedIn, Twitter, subscribe to us on YouTube. Dr. Taylor, thank you so much again for coming on today, and to all of our audience, happy Human Rights Day.
Yeah, great to be here. Thanks, Ross, and happy Human Rights Day to all.